So for a program that is still screening survivors out due to substance use, but they want to do something different, right? What are some ways that they get started?
I would say rip off the Band-Aid. Decide where your bar is. Know your contracts, know your requirements, know whether those requirements are mandatory for, so, some programs have multiple locations. And most of the time, contracts and licensures are location specific. And that was something we learned when we started this process is we can do anything we want over at our outreach offices. We don't have, if someone comes in with meth in their bag and they pull it out, I don't have to do anything about that. I can respectfully ask them not to smoke it in the building because that's a problem for me. But I don't have to like deny them a service. You know what I mean? I have more options. At our shelter, though, it is more specific. So figure out what your contracts say and understand what exactly you are regulated by. Second, I would say that decide what your facility can actually accommodate. If you're in a facility that you have places like a room off in a different wing, or maybe you have individual tiny houses or whatever it might be, if you have the ability to do something our program can't, like having a sleep it off room that is safe and doesn't have sharp objects and like relatively serene space, if you can do that right now, do it, because you are going to save yourself so many midnight phone calls for your staff to have the power to just say, you know what, let's have you stay in the butterfly house tonight. Here, be by yourself. I'll get you some popcorn. Here's some art supplies. Here's a bunch of movies. You need to do what you need to do. And they come out in the morning and I'll tell you, I've never had that happen where we've had to send someone away where they haven't come back so embarrassed of their behavior. And there was something that triggered it. Every single time there was something that happened that made them get to that place, because the majority of the time they have like a level of use that is consistent and they don't get out of control every time they use. That's not normal. And so if you have a place to accommodate that and keep them safe, are you willing as a program, and this is something we ask our staff, would you rather get a call that a client you had worked with passed away, whether that was overdose, accident, murder, car accident from driving? Do you want that phone call? Or do you want to have to talk someone down who's super drunk and tuck them in? Which one? Because if you answer one way, you just shouldn't work here.
Mm-hmm.
Social work, it's messy. But which call do you want to make? And so it really determines how far you're willing to go. So if you have somewhere where you can do that, everywhere needs a drunk tank, for lack of a better term. And then look at your rules. And there is a manual, and I can't remember if it came from the Washington Coalition, but it talks about moving away from a rules-based approach for shelters. And if you haven't read it and used it, some of it's a little outdated, but there's a lot of really great information. We don't have a curfew at our shelter. I'm sorry. If you were a grown adult human being and you haven't had a curfew since you were in high school, it is not my business what you want to do at 2 a.m. It just isn't. It's my business if you never come back to the shelter and occupy your bed, because I need that bed for other people. But there are ways to mitigate that by talking about that with your clients, and you're going to stop having so many problems. They're going to stop calling you. It's magic. We did with curfew. We did away with excessive like room checks and safety searches. We used to bring drug dogs in. This is embarrassing. We used to bring drug dogs into our shelter like frequently to sniff out drugs. And come to find out, it was really traumatizing for our clients. And not just our adult clients, but we'd have kids who were terrified of dogs. And police officers with scary dogs are scary. They don't make it feel safe. It feels like a prison. We did away with all those things. Now we have like clean room checks. So we pop our head in, we see the state of the room at a time that they are expecting, and they know what's expected. We don't expect them to be able to bounce a quarter off their bed. We just want to know that there's not, food lying around on the floor, so that we don't have rodents or ants, because it's our job to keep that space healthy. and we want to know if, everything's working properly, or if anything's broken, or if the fan's hanging off the ceiling at a weird angle. And we want to ask if there's anything we can do to help. So we're checking in. They know we're like showing up. We're looking to see if our smoke detectors are taped off because they're smoking in the room, and we can talk about why that might be a safety concern. And those are the things we do. And then when people leave, then we do a deep clean of the room. We do it safely. We wear protective equipment. And most of the time, we don't find anything. We find gross things like Cheetos under the bed that have fallen, but we don't find like baggies of heroin. So like, let yourself just try it for a couple of months and see what happens. Get away from the rules and just find a minimum bar of safety that you can come to, and do it with your staff. Do it with the staff that are there at nighttime, during the day. Don't do this as a management or a leadership team, because you are not the ones seeing these clients in the states that they're in. And your staff are so knowledgeable, and they know so much more than you. Unfortunately, they just do, about the clients that are there. So ask them, what are the rules that you constantly have to get on people's, case about? Is it necessary? Have we talked to Stacy 50 times because curfew's 10 and she comes in at 10:05, and then we finally had to ask her to leave because like you have to follow through? Could you have avoided all of that? So that's where I would start. Get rid of your rules, find out what your bar is. Our safety bar is violent behavior, whether that's verbally aggressive or actually physical, or specific threats. That's what our level of that we're comfortable saying, you know what, you're not making this a safe environment, and we have to help you find somewhere else to go. And we don't ever say, good luck, good riddance, you're on your own. They have access to every other service that we provide, and we'll help them try to find another place to go. And they're not cut off from our advocates or our caseworkers. It's just that our shelter service isn't something we can offer them right now because of this concern. And I think that just start somewhere, and don't wait until everything is perfect, because you're going to adjust it a million times. But the survivors are going to benefit more from you making changes immediately, even if they're small. And if you have questions, call programs like ours that are doing it or that have done it. If you call me and say, how do I handle this client who is knifing a bear in the kitchen, who has an untreated mental health condition? I've seen that. I see that twice a week. I've seen the clients that poop on the couch. We're not sure why, but they do. Programs know programs. And we are super open to being like, this is what we did, or do you have this in your community, or I learned this. And that's why hubs like this are so important, is because we've learned as advocates, the best way to learn about being an advocate and running a program is to talk to other programs. So don't live on your own thinking that you have to figure this out, because you don't. There are some of us that have already done it. Save yourself the heart attack, because it's just not worth it.